Okay, well, welcome, Dr. El-Sheikh and Dr. Tahani. So today's session, as part of the medical education series for the Medina Clinic, is going to be on integrative medicine. So the mission of the Medina Clinic is to provide is really two things to provide actually. One is to provide charitable medical care to individuals who don't have insurance in the Kansas City metro area. And so that's something that the Medina Clinic has been doing for over 10 years now. The other mission for the Medina Clinic is to provide educational opportunities so that medical students and postgraduate students can advance in their careers and enter residency. So those are the two main parts of the mission for the Medina Clinic. As far as the medical education series, there are a number of topics within family medicine that are very important, and they are in addition to the core biomedical topics. So these include topics regarding communication, as well as community health. The reason why these topics are so important is that when we look at communication, one of the categories that residents are evaluated on is communication and interpersonal skills. So a lot of times different topics regarding communication are not really emphasized, especially if you didn't get training in the United States, or it may not be emphasized the same way, or it may not be the same concepts. So this is filling a need that a lot of students have, because again, they may not have gotten that in their training or background. And if you're going to be a family physician, these topics are very, very important. Let's see, that's as far as communication. So again, there are 6 categories actually that residents are evaluated on. One of them is communication and interpersonal skills. So how you communicate is very, very key. And for some residents, that's why they don't succeed, even though they're fine on the medical things. But when it comes to these other topics, they're not, and they don't succeed because of it. So, and as far as community health, well, we know that something that's very something that where there's more awareness of nowadays is population health, and that's part, that overlaps to a significant degree with community health, the health of communities, social determinants of health. These are all things where there's growing awareness on. So again, that's not something that you have deep training in during medical school. And then when you go into residency and become a physician, these are concepts that that start to become more important. So that's why for the initial part of this medical education series, we're focusing on these topics. And so the way we go through these topics is we have case studies to go through, and we analyze these different cases. The way we analyze it is we go through multiple choice questions, and these multiple choice questions kind of bring up the concepts that need to be understood. Another benefit of going through the multiple choice questions is that it actually is a way to address test taking skills as well. So test taking skills also is sort of part of this. The source for this material, it's on every slide here. It's Swanson's Family Medicine Review. So that's the reference for all these cases. So any questions at all before we get started?
No, that's fine.
No? Okay. All right. Well, we'll go ahead and get started here. So the first case. So when it comes to integrative medicine, I will say there are alternative medicine specialists out there. There are people who get their doctorates in alternative medicine. It's not traditional medicine, but it's alternative medicine. And this discipline has a lot to offer when it comes to a lot of patients that you see in the real world. There's a thing about outpatient care, which is what I was taught in training was that 60% of the issues that you see in clinic, if we're talking about a family medicine outpatient clinic, 60% of the issues that you see, you actually will not have a diagnosis for. It will not be clear what the diagnosis for, or we frankly just may not know right at that time. So, and for a fair number of these issues, it's possible we may never arrive at a definitive diagnosis despite appropriate workup and management. So this is where, when there is no definitive sort of biomedical or organic cause for certain issues, this is where alternative medicine can have, I think, a real role to play when it comes to taking care of patients. So, do you guys have any experience with integrated care or alternative medicine?
No, not for me.
Okay, so hopefully this will be valuable. All right, so clinical case problem 1. It's entitled, are those all the medications that you take? So this should be interesting. Okay, we have a 35-year-old white female school teacher who presents to your office to establish care. She completes a medical history survey that says that she has fibromyalgia and hypoglycemia. The only medication listed on her form is an oral contraceptive agent. But when interviewed, she adds that she also takes multiple dietary supplements as well. She requests that you perform a well woman exam and renew her birth control pills. Okay. So this is actually a pretty mild case of alternative medicine. You have someone who is fairly healthy, but she reports taking multiple dietary supplements. Okay, so number 1, which of the following aspects of this case does not match the typical user of complementary and alternative medicine therapies? Is it A, a high percentage of users are female? B, after prayer, use of natural products is the most common form of complementary and alternative medicine therapy, or we can say CAM. C, the majority of users have at least some college education. All right. D, despite the use of CAM, the majority of users continue to see conventional practitioners. Or E, the majority of CAM users inform their physicians. What would you guys say? What does not match the typical user?
I will choose E.
Okay, got E. All right. Dr. Tahani, what would you say?
E too.
E. I might agree. So let me take a look here. So a higher percentage of users are female. Well, the female population, they may be, and the organizations I've been with, they're a majority of the population that we see. So it's not unreasonable. B, after prayer, use of natural products is the most common form of CAM therapy. It certainly sounds reasonable. I don't have a lot of reason to doubt it. I don't know, though. I don't know for sure, but it doesn't sound unreasonable. So A and B, kind of put a pin in it. I might like A a little bit better than B as far as what's true. And I think the question it's asking, what does not match? So we want what's not, I guess what's not true. The majority of users have at least some college education. So, okay. So I recall a patient who was, she was kind of complicated. And, alternative medicine was something that she was looking into. And I recall her being a more highly educated patient, actually. So I don't know. I think C, it's consistent with I feel like it's consistent with what I've seen before. D, the use of CAM, the majority continue to see conventional practitioners. I think that's true because they have to a lot of times, alternative medicine practitioners are not going to prescribe their hypertension meds. And a lot of patients do try and do a good job, as best as they can. So I think D sounds kind of true. So the majority of CAM users inform their physicians. Yeah, no, I don't. I have a lot of doubt about this one. So I agree. I have the most doubt on E compared with the other one. So I would go with E. All right. So number one is indeed E. So CAM has been defined as a group of diverse medical and healthcare systems, practices, and products that are not currently considered to be part of conventional medicine. The term integrative medicine has been used to describe the combination of evidence-based CAM modalities with conventional medicine. So that's something to keep in mind, that integrative medicine is a combination of those. Despite the relatively common use of these therapies, often estimated to be between 35 and 65%, the majority of users do not disclose this to their medical physician. The most common reasons given are that it wasn't important for the doctor to know and the doctor never asked. So what does this mean when you take a medication history from patients? What is that? What then do we have to do when we're updating the med list?
Usually, I ask my patients specific question. Do you have other medication? Do you have supplementary?
Perfect. Yeah, exactly. So yes, when getting the medication history, you want to ask about supplements, you want to ask about herbal. So absolutely. Okay, perfect. Okay. Yeah. Now what's interesting for me is that this particular patient, she was a little bit complicated. She was on a lot of meds. That's why I wonder, when I look at the title, are those all the medications that you take? She was on a lot of stuff, actually. So I think there are, however, a lot of patients who, are not as complicated, but they have some constitutional symptoms for which it's not readily clear what the cause is. So a lot of patients like that may benefit from alternative medicine. So number two, which of the following statements is true regarding CAM in general? Is it CAM therapies are rarely covered by health insurance? The use of CAM peaked in the 1990s and has steadily declined. The US government funds several $100 million of CAM-related research annually. The majority of US medical schools do not have curricula regarding CAM. Or E, the most CAM users turn to these therapies because of their dissatisfaction with conventional biomedical care. What would you guys say? Which is true?
I'm thinking of D.
D, okay. Yeah, D is an attractive one. I do not know the answer to this. Okay, all right. Any other? Was that A? That's reasonable. So now remember the thing about test taking, which is that sometimes you don't have to know the answer to be able to get it correct. So you base your thinking based on, or your thinking is based on what you already know, and you know something. So let's apply that to see if we can get the answer here. So A, CAM therapies are rarely covered by health insurance. So let me think. one type of therapy is acupuncture. Um, we actually have, I know that there's an alternative medicine specialist in town, and she is hired by a large health system. So I would think it would need to be covered by health insurance. So I have a lot of doubt. I have a lot of doubt about A based on that. Okay, B, use of CAM peaked in the 1990s and has steadily declined. I'm not, so also not quite sure about that. If that were the case, would a health system actually hire an integrated or alternative medicine specialist? Not so sure about that. So I have some doubt about B. C, the US government funds several $100 million of CAM-related research annually. Oh, that's a good point. Now, what's interesting is that this is the longest answer, and it is C. C is statistically your correct answer. So yeah, so I'll take C over A and B. Let's just put it that way. Not quite sure, but I would take C over A and B. So we can put a pin in that. D, the majority of US med schools do not have curricula regarding CAM. Yeah, so it's one of those things where certainly at some point, like when I was in medical school, I don't recall that. Certainly, it's one of those things where I'm sure that is true at some point, but I wonder if schools have, schools are generally responsive to these things, and so it's possible medical schools would have, introduced that. It seems like something that would have been done by now, although I'm not positive. So I would probably, take C over A, B, and D at this point. Again, I don't know the answer. It's possible I may get it wrong, so we'll see. But I'm thinking so far, I have some doubt about D. So I think C, I have a pin in C at the moment. So let's look at E. Most CAM users turn to these therapies because of their dissatisfaction with conventional biomedical care. I mean, I can see where that's true in a lot of cases. But it really might just be a philosophy. Sometimes it's not their dissatisfaction with the care. Sometimes it's just a matter of taste or a matter of preference. Sometimes, patients, they don't like the environment of the doctor's office, yeah, so yeah, but I can see how this could be true, I guess for me, so if I go to C, the US, so for me, I'm kind of between C and E. The US government funds several $100 million of CAM-related research annually. Several $100 million. That's a lot. That is a lot. So do you guys know of like any NIH grants for alternative medicine? Are you guys aware of anything like that?
Not that much, yeah. It's a big number.
Yeah, that's a lot. Now, so I'm trying to think, what do I know about this? Not much, to be honest. I have to say, I don't, several hundred million. Wow. Yeah, yeah. So the thing is, I mean, I could see where we have colleagues who research and would apply for grants. I mean, I have one colleague on the faculty here, she's part of an academic, I mean, she's part of a faculty, she needs to do research, and she does. And this is her specialty, actually. So there's not just an alternative medicine in town, a specialist in town, but I have a family medicine colleague. By the way, you can get extra training as a family physician in alternative medicine, by the way. So if that's the case, I don't know. I think there several hundred million sounds like a lot. But I'm thinking I have more doubt about E than C. So I don't know, but I have more doubt about E than C. So because of that, I think I'll go with C. All right, you guys ready? We all voted on different things.
Yes.
Okay, number 2 is C. Woo! There we go. Finally, you think it through and you get it. Okay, so wonderful. Well, I'm excited, I have to say. So let's check out the information, shall we? So the National Center for the National Center for Complementary and Alternative Medicine, which is part of the NIH. So this would have been a good thing to be aware of, actually, which is part of the NIH, was established in 1998. It, along with other NIH centers, funded approximately $300 million in CAM research in 2005. So for me, I was not aware of that, unfortunately. Now I am, but I do know I have a faculty member colleague who is, she's in academic medicine and she specializes in alternative medicine. So for me, while I did not know C directly, I did not directly know it, there's some indirect information that could suggest C is true. And that's why I picked it. You could tell I'm excited I got it. You don't always get it. So anyway, so CAM, complementary and alternative medicine use, continues to be common in the United States. Although much of it remains out-of-pocket expense, treatments such as chiropractic and osteopathic manipulation are frequently covered by insurers. That's another thing, by the way. So chiropractic care can fall under this. And in fact, even if I thought about it a little bit more, I could have concluded that because we have chiropractors in town and they bill insurance all the time. We also have, I don't know if you guys are familiar with osteopathic medicine. Have you guys come across that before?
Yes. Yeah.
Tell me, Dr. Abir, what's your experience with
I think
osteopathic physicians or osteopathic medicine?
they said the body able to heal from inside by itself. So usually they recommend training, breathing technique to relieve stress. They put this first, the second line, the medication.
Okay.
So this is the process.
Wonderful. Okay, that makes sense. Okay, that makes sense. I think we have students at our organization. We have students who are they're students from the osteopathic medical school here called Kansas City University, and it's the largest osteopathic medical school, I think, in the Midwest. Well, that might be a strong statement. In this area of like 4 or 5 states at least. And we have a lot of students that come through, and the students offer to do osteopathic manipulation techniques on patients if they have headaches or if they have different musculoskeletal pains. And so they actually, when they get out into practice and they do the osteopathic manipulation techniques, they then are able to bill insurance for it. So that if we thought about that a little bit more, A would have been more obvious. Okay. Let's see. According to the latest surveys, the majority of US medical schools offer curricula regarding CAM. Okay. And that's the thing, is that medical schools, they're usually like, when there's a gap identified, they're usually, pretty aggressive in bridging those gaps as much as they can. The majority of CAM users continue to see conventional medical physicians, but use complementary therapies because of a belief that other treatments are more congruous with their personal values, beliefs, and philosophical orientation towards health and life in general. So, okay, good. Guys have any questions on this one?
No, it's clear.
Okay, so yeah, so, and also I think it's an example on how, even though you may not know the answer, you know something. Use what you know to try and arrive at the correct answer, even if you don't actually know what the correct answer is. So that's the key concept regarding test taking that I would share. Number 3. In this case, Which of the following options would be least appropriate? Is it A, ask the patient to provide you with a complete list of her supplements? B, obtain additional information about her diagnoses of fibromyalgia and hypoglycemia? C, inquire into other CAM therapies that the patient may be using. By the way, I will say that when patients will come in with a chief complaint of hypoglycemia, not uncommonly actually, and when a patient mentions this, it's a good idea to ask, how, or get a little bit of information such as how it was diagnosed. Was a blood sugar checked at the time of having symptoms? What was it, a doctor who determined this, or was it something that they concluded on their own? So that's something that I would typically try to do if a patient mentioned a history of hypoglycemia, because maybe they're saying it's hypoglycemia, but they're really talking about the symptoms and potentially it's something else. So anyway, C, inquire into other CAM therapies that the patient may be using. D, when dictating this encounter, simply state that she is taking dietary supplements because it is not necessary to list each one in the record. By the way, we don't dictate this encounter. You know what this means? Maybe I need to get a more updated reference source actually, because we don't really, look, I have not dictated since residency. That was the last time I dictated. So yeah, maybe I dictated once in practice. But anyway, yeah, we don't really dictate that much anymore. So makes me wonder if I need a more updated reference. E, perform a complete examination that is appropriate for her age and medical condition. Okay, so which one is least appropriate for this patient? You're a 35-year-old school teacher on multiple supplements, therefore a well woman exam. What would you do? Or what's the least appropriate?
D. I would say D.
Okay, I'm sorry, what did you guys say?
D.
Yeah.
Got one for D. Okay, do we have another one for D?
Yes, D.
Another one for D? Okay, let me see. That sounds reasonable. So ask the patient to provide you with a complete list of her supplements. Well, we started off our session saying that's what we need to do. So A is definitely appropriate. So you can eliminate it. B, obtain additional information about her diagnoses of fibromyalgia and hypoglycemia. Oh, how funny. We were just talking about that as well. So obtain additional information. Yes, I focused on the hypoglycemia and forgotten that B, that my point on hypoglycemia was actually B, was actually that answer. So we got done talking about that. So I would probably eliminate B. Yes, you need more information. C, inquire into other CAM therapies that the patient may be using. Sure. I mean, have they gone to a chiropractor? Sometimes patients will volunteer that, but not always. Have they gotten acupuncture? That's not a medication after all. So C seems reasonable. I would eliminate that. D, automatically is talking about dictating, so you're kind of suspicious from the get-go, but probably more important, it is not necessary to list each one in the medical record. That seems completely opposite of A. So A and D, I do not believe both can be correct. So D is definitely a favorite. E, perform a complete examination that is appropriate for her age and medical condition. And that's what she's there for. So E seems appropriate. So therefore you could eliminate it. So I would agree. I would go with D. Okay, number 3 is, not surprisingly, it's D. So the term dietary supplements is given to a broad range of products that includes vitamins, minerals, herbals, and amino acids. Okay, so all that stuff is our dietary our dietary supplements. Vitamins, minerals, herbals, and amino acids. And of course, amino acids, those are the building blocks of proteins. Because many drug supplement interactions have been documented, it is best to have a complete listing of these products in the patient's medical record. Okay, so that's pretty straightforward. Okay, good deal. Number 4. So, which of the following is not true about dietary supplements? Is it A, the US Food and Drug Administration does not regulate these products? Is it B, they are not considered drugs and therefore do not have to prove their efficacy and safety? Is it C, supplements are not allowed to make any claims of curing or mitigating disease? D, they must state on their labels, this statement has not been evaluated by the Food and Drug Administration? Or is it E, the most common reason people take these products is a belief, should say belief, that doing so promotes good health? What would you guys say? So just remember, use what you know to try and arrive at the right answer.
I'm thinking of D.
D, okay.
A.
A, okay. Now for me, I admit I accidentally saw the answer to this. So I apologize. So I'm not going to guess on this one. So I can tell you that the answer is indeed A. Okay. So who said A? Was it Dr. Abir?
Yes.
Dr. Abir, you got it correct for us. Please explain to us your rationale for selecting A.
I know that the FDA does not evaluate this supplement, and they usually put this statement in every supplement, but they do regulate this supplement.
Okay. So you're saying that they do have a role in oversight, while it may not be to the same degree as other meds, but they do have some role in oversight. Is that right?
Yes.
Okay, perfect. Okay, so Dr. Tahani, now, while we know that, A is the correct answer on this one, why don't you walk us through your rationale on why you selected D?
Actually, I wasn't sure about the answer, but I thought so they must state in their labels. I'm not sure if they have labels that say that or not.
Right. So you, it sounds like you had some doubt about D, and maybe that's why you selected it.
Yes.
Gotcha. Okay. Well, let's check out the information here. So in 1994, the Dietary Supplement and Health Education Act was passed by Congress. Since that time, the FDA has regulated supplements as food products and not as drugs. Okay. If the ingredients in a supplement were sold in the United States before this act, safety data are not required. Also, no efficacy studies are needed as long as the product does not claim to treat, cure, or mitigate any disease. The most common reason that vitamins and herbals are taken is a belief that they promote good health. Okay, so it sounds like the main things here are that the FDA, they regulate supplements as food, not drugs. They don't need any efficacy stuff. So they need safety. They need safety information, I believe, but they do not need to evaluate any efficacy so long as the product is not claiming to cure or mitigate any disease. So if we look at B, so A is not true because we know that they oversee these supplements as, category of foods. B, they are not, if we look at B, they are not considered drugs and therefore do not have to prove their efficacy and safety. So that's true. They're not considered drugs, so they don't have to, although it says and safety. Let me double check that. Hold on. If the ingredients in a supplement were sold in the United States before this act, safety data are not required. Okay. I guess that's an open question if they need safety data. I guess before this act, before this act in 1994, they do not need safety data, but it looks like after, yeah, if ingredients in a supplement were sold in the United States before this act, safety data are not required. Oh, how interesting. Okay. Huh. So this is kind of a smaller point, but if the ingredients and the supplements were sold before this act, then they don't need safety data. So they only need safety data if there are new ingredients after this act, I guess. So that's interesting. Okay, but in any event, they're not considered drugs, so they don't need efficacy data. Supplements are not allowed to make any claims of curing or mitigating disease. We talked about that. And they must state on their labels, this statement has not been evaluated by the US Food and Drug Administration. Interesting. What statement are they talking about, I wonder? Yeah, that is interesting. Do you guys know what statement that they're talking about?
This statement, yeah, it does not evaluated by FDA in every supplement, mainly
Yeah,
over the counter vitamins or proteins. Yeah,
okay,
they put this statement.
okay, all right. The most common reason people take this product, yeah, we talked about that. So, okay, all right. I wonder if let me see if we can pull it up actually. Let me see if I can pull it up. Hold on a second. Images, label, we'll say FDA label on a supplement. Let me see if we can pull it up. Google Images. See if I can find something from the FDA here. Okay, I think here's one. There should be an FDA disclaimer. So let me new share. I believe it's this one. Can you guys see this internet?
Yes.
Actually, this is a better one. Hold on. Okay, this is better. So, so if you see here, it says FDA disclaimer, these statements. So here's a functional description. It says the natural fish oil concentrate used in this whatever is manufactured under strict quality control standards. It is tested to be free of potentially harmful levels of contaminants. Those who experience nausea or reflux from other fish oils should find this enteric coated odor controlled soft gel easier to tolerate. So there's the description here. Then there's another qualified health claim. Supportive but not conclusive research shows that consumption of this the components of the fish oil may reduce the risk of coronary artery disease. Oh, interesting. And so here's the FDA disclaimer. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. So there it is. So
Yeah,
when it
this is
says these statements, yeah, they're talking about all this stuff up here. What do you guys think about that?
about the FDA disclaimer, because the previous statement, the company provided this one.
Right, right. Yes. So when it says these statements, this statement or these statements, they're talking about, yeah, what the company is saying. So, okay, good. Guys, ready to move on?
Sure. Yes, sure.
Okay. All right. So which of the following is not true about herbal products? So we're not really talking about dietary supplements anymore. We're talking about herbal products. So is it A, St. John's wort has been shown in studies to be effective in the treatment of mild to moderately severe depression? B, St. John's wort has been shown to evaluate or to elevate the levels of some drugs such as cyclosporine and digoxin by inhibition of the cytochrome P450 pathway in the liver. C, some herbal products have been found to have contaminants such as heavy metals or prescription drugs. D, ginkgo biloba, commonly taken for dementia-related concerns, can interfere with platelet function. Or E, studies have shown that some herbal products may not contain the dosage that is stated on the package label. Okay, guys, which of the following is not true? What would you say?
I would say B. I think it's cytochrome P450 inhibitor inducer.
Now remember, it says which of the following is not true. Does that change your answer at all?
I would say B.
Say B? Okay. Good. You guys are closer to medical school than I, so I think you may have a better shot at this. Okay, that was who? Was that Dr. Abir who voted B?
Yeah, me too. But since St. John is inhibitor, not in inducer, not inhibitor.
Oh, you see, well, I'm going to go with you guys for sure. So let's take a look here. Which of the following is not true? All right. St. John's wort has been shown in studies to be effective in the treatment of mild to moderately severe depression. Yeah, I actually had some doubt about that. I'll put a pin in that. St. John's wort has been shown to elevate the levels of some drugs such as cyclosporine and digoxin by inhibition, but you guys are saying it's actually, this is just flat out wrong. You guys are saying it induces, I believe.
Yeah.
Okay, well, there we go. I mean, you guys, I think that's it then. Some herbal products have been found to have contaminants such as heavy metals or prescription drugs. I believe that is true, actually. In speaking with an alternative medicine specialist colleague in the past, there are real concerns about this, and some products are definitely shady and not, they don't have as much integrity as other products. So definitely, I think C is true. So it is definitely not the answer, so I can eliminate it. Ginkgo biloba, commonly taken for dementia-related concerns, can interfere with platelet function. I believe, I can't remember specifically, but I thought there was that was a concern in working with patients who are on that. So D is probably like lower on the list.
Yes.
What's that now?
D is true statement. Yeah, it's called bleeding.
Okay, there we go. Perfect. E, studies have shown that some herbal products may not contain the dosage that is stated on the package label. Yeah, I think some of these herbal products are shady. So I think E is definitely true. So that's off. So St. John's wort has been historically, an option, but I thought there was some more recent evidence on that, that mitigated its or that showed that its effectiveness was not as much as it was thought to be. But you guys know for sure it's B, so I mean that's got to be the answer. So let's take a look at this. So the answer is indeed B. Good job. See, it helps when you just flat out know it. When you flat out know it, you don't have to think it through. But just remember, make sure you think it through if you don't know it, because you can still get it. Okay, so let's look at the facts for that. So St. John's wort has been shown in several studies to induce cytochrome P450, which may lead to subtherapeutic levels of some drugs such as cyclosporine, digoxin, and oral contraceptives as well. And that's it. That's all there is. There's no other facts for B. So good. Well, you guys nailed that one. So I could have, but St. John's wort is I did not think it was recommended. So clearly I need to update myself on this, but it's not, I did not think it was recommended as a part of the management in the office. So maybe after we do communication and community health, we should go to behavioral health after this. Okay, guys, which of the following supplements or match the following supplements with the condition most associated with its use? Okay, let's do this together, shall we? That might be easier. So, okay, here's the thing. So I think D, echinacea, I'm going to say A on this. And
Yeah,
I'm
it
gonna
is
say,
A.
was
Yeah,
that?
it's asthma, used for asthma.
What is?
Yeah.
It's used for asthma.
Okay.
Yeah, you are right.
Okay, perfect. So I think if that's the case, that looks correct. Black cohosh, I know black cohosh has been taken for B, although to be honest,
Yes.
maybe I was confusing black cohosh with St. John's wort, actually. I think the issue with St. John's wort is that the risk outweighs the benefit. I think that was the issue, and maybe that's why it's no longer recommended. Black cohosh, as far as menopausal symptoms and even dysmenorrhea, black cohosh, I think the evidence for that is not, it's not as robust, the efficacy is not what it previously was thought to be. Maybe I was thinking of black cohosh actually. And with St. John's wort, it's more risks outweigh the benefit. So again, I need to update myself on that, but maybe that's what it was. Okay, what else, guys?
Kava, I think for anxiety.
For anxiety,
D.
okay. D, good.
And A, palmito for prostate enlargement.
Yeah.
Okay, good.
And
I guess this must be E.
I think this for liver disease, but I'm not.
Milk thistle, okay. Okay, I'm impressed. I'm very impressed. You guys really are you guys have a lot of good fund of knowledge for this topic. So let's take a look at the answer, shall we? So number 6. Okay, guys, saw palmetto, you are correct. It is C. Saw palmettos for prostate enlargement. Milk thistle, you are correct. It is E for liver disease. Black cohosh, you are correct. It is B for menopausal symptoms. Echinacea, D, you are correct. It's for respiratory symptoms or infections. Kava, you're correct. D for anxiety. Okay, you guys nailed it. Good job. All right, number 7. Oh, by the way, you guys know this quite well. Have you guys had patients on any of these supplements?
For me, no, but I just learned them from USMLE.
So you just flat out knew it. Good. What about you, Dr. Abir? Have you had any patients on these supplements?
She used echinacea for respiratory infection, and she said for the last 10 years, protect her from getting infected. So
I see. So you know what?
he
And
said it's very beneficial in preventing respiratory infection.
is that right? So your patient felt that it was effective?
Yes, echinacea, yes.
Okay. So you know what we can do? Let's check out the latest evidence on that. Let's see what we have here. Hold on one second. Have you guys used UpToDate before?
Yes.
Yes.
Okay, very good. So let's go to UpToDate and let's check out. Let's real quick. I mean, there's a few different references. We can always go to the AAFP as well, but let's look at echinacea. Let me new share. Let's go here. Okay. So clinical use. Let's see what evidence there is. Summary. So although echinacea may have some immune stimulating effects, the evidence to date does not support its efficacy in treating the common cold, and we recommend not using it for this purpose. Okay. Echinacea may have a weak effect on the prevention of colds, but the questionable benefit may not warrant possible adverse effects or events. Pending more compelling evidence for benefit, we suggest not using echinacea for prevention of upper respiratory tract infection. Echinacea appears to be relatively safe, although gastrointestinal side effects and allergic reactions have been reported. As with other herbal preparations, variability of echinacea preparations is an obstacle to its potential use by patients and prescription by clinicians. So was it Dr. Tahani who had the patient who was on it?
No, me.
Oh, so Dr.
Yeah, she used
Abir.
it as prophylaxis, yeah.
Yeah. So it sounds like, so would this, if you were to read this in the office, would this cause you to dissuade the patient from using it? Or would you advise the patient that, if it's worked well for her, she could continue it?
I said that there is no evidence-based support for using of it, but she said by practice for the last 10 years, she never got a cold because she used it as a
Yeah, very good. So I would agree. I think that it's worked well for her. She's tolerated it well in the past. So this information is moot. They're moot points for this particular patient. So that I would agree. Okay. Well, good deal. So moving on, number 7. In the current case, which would be the least appropriate option? So believe it or not, we're still with the 35-year-old school teacher who is on, what was she on? Herbal supplements? What was it? Let's go back. She takes multiple dietary supplements. Okay. And she wants a well woman exam and she's on birth control pills. So for this patient, what is the least appropriate option? Is it A, ask the patient to describe the reason that she is taking each of the herbals? B, discuss any potential harm, such as drug-herb interactions that may occur with the specific supplements being taken. C, try to convince the patient to stop taking all of the supplements because they do not have the same level of evidence as drugs do. D, provide the patient with a list of reliable sources of CAM therapies, including appropriate websites. Or E, invite the patient to be an active participant in decisions about her healthcare, such as treatment options and, should say, any laboratory testing. What would you guys say?
C.
What's that?
C.
C. Okay. Dr. Abir, what do you say?
C.
Yeah, I would probably go with C as well. I think, well, if we go through it, ask the patient to describe the reason that she's taking each of the herbals. That's certainly appropriate. So I would probably, I don't know, I'd probably eliminate this. D, discuss any potential harm such as drug-herb interactions that may occur with the specific supplements being used. Also, that seems very appropriate. So I would eliminate that. C, convince her not to take it. So it's interesting, we're talking about the echinacea, right? And we just talked about how that, you know, when looking at just a summary of the of how much just a summary description of the evidence behind it, we talked about, what did we agree, Dr. Abir, that we would dissuade her from taking it or just let it be?
I would try to convince her, but not in this way.
Yeah.
Yeah.
I think what we agreed is that we would not try to convince her to stop taking it, right? Because it had been working well for her for 10 years. I mean, this is kind of a similar, situation as this answer. She's on it for 10 years. It's worked well for her. She's happy. She feels like it's effective. So to try and convince that patient of yours would probably be inappropriate. So based on your experience, Dr. Abir, C would be not appropriate, even based on your experience. So that's why C, we would put a pin in it. That's probably the most likely thing. D, provide the patient with a list of reliable references and resources. That sounds appropriate to me. And that's something you can even push in the patient portal. E, invite the patient to be an active participant in decisions on her healthcare. I mean, that's always appropriate, basically, almost always appropriate. So yeah, I would go with C, and the answer is C. All right, so basically, although dietary supplements do not usually have the same level of evidence as prescription drugs, favorable data do exist for many products. And in fact, with the echinacea, there is some weak evidence that it prevents colds, right? As was the case with this patient. Whenever possible, it is best to honor a patient's preferences for therapeutic options, including the use of complementary and alternative medicine, if there are no significant contraindications. Okay, so a lot of times patients in the office, they'll say, "Doctor, I'm taking this, is that okay?" And what you can do is, research it, double check it, and then let the patient know. And usually, personally, if there are no strong contraindications for the patient taking it and the patient wants to take it, I usually say, that's fine, go ahead and continue it. Okay. Let's look at number 8 real quick. Okay. During the office visit, the patient states that she is interested in a holistic approach to her care. Which of the following would be your least appropriate response? Is it A, respectfully explain that you are a family physician and holistic care is not part of your scope of practice? B, discuss the use of low-impact cardiovascular exercise for the treatment of fibromyalgia? C, explain the importance of small, frequent, nutritious meals to help alleviate her hypoglycemic reactions? D, discuss the benefits of relaxation techniques such as meditation and guided, meditation and guided imagery to reduce pain? Or E, offer to set up appropriate referrals as needed and help coordinate her care? What would you guys say?
thinking of E.
Okay. So you're thinking E is the least appropriate, is that right?
Yes.
Okay. Dr. Abir, what would you say?
A.
Like A, okay. Me personally, just looking at this, I like A too, but let's go through it. Respectfully explain that you are a family physician and holistic care is not part of your scope of practice. So for me, that's a little suspicious. Like, since when is holistic care not part of the family physician? Oh, you know what I mean? Like, you're a family physician, holistic care is not part of your scope. That's a contradictory kind of statement. So yeah, A right away sticks out. B, discuss the use of low impact cardiovascular exercise for the treatment of fibromyalgia. Well, look, the question is asking, what is your least appropriate response? For me, A is more, it's inappropriate compared with B. So I like A more than B. C, explain the importance of small, frequent, nutritious meals to help alleviate her hypoglycemic reactions. That sounds reasonable and appropriate to me. So C, I would say, is less desirable than A. A is my most likely one. B and C are below A. So right now, A is my top one. D, discuss the benefits of relaxation techniques such as meditation and guided imagery and so forth. I mean, that sounds appropriate too. I mean, it's just another appropriate sort of thing to mention. And especially she's talking about holistic care. So far, with the holistic care, you are talking about exercise, you are talking about nutrition, you are talking about relaxation techniques. Like, that is all part of holistic care. So B, C, and D are sort of a level, I mean, they're below A. A is more favorable. Now E, I see that we have, we're one of us thought A was it, and E, seemed there was some doubt about that one. So I think, Dr. Abir, can you share with us your rationale for your doubt for E?
Because I feel it is appropriate to refer the patient as needed. We have to try it's treatment of fibromyalgia. It's a little bit challenging because some patients respond to aerobic exercise, some patients need upgrade to a medication. So I have to try all this lifestyle modification first. Then if the patient is still complaining and ask for referral, it's appropriate to refer her and coordinate her care. So we can refer her for acupuncture or for, as we said before, like integrative medicine. It's okay, we can refer her. So I feel A is a good option to answer this question here.
Oh, I see. Oh, Dr. Tahani, you're the one who said E.
Yeah, actually, I
Oh, I'm
missed
so
the
sorry, Dr. Tahani. Dr. Tahani, can you explain, walk us through your rationale for E?
Actually, misunderstood the option. I thought they have to refer the patient to the holistic care.
Oh, okay. So if that's the case, what would your answer be then? Is it still E?
I would say A. I would say A.
You like A, okay. Yeah. So that's always important with test taking is, you want to make sure, read the answer as best, make sure you read it carefully. So yeah. So I basically agree with you guys. I think B, C, and D we talked about. The referrals, they're specifically saying appropriate referrals. And something that I actually didn't think about that Dr. Abir mentioned is that it could be referrals to acupuncture. It could be referrals to a chiropractor. So it's not necessarily the medical specialist. So that could be the type of referrals it's talking about. And then it says as needed. So it's not saying that you're going to refer them now. Maybe you'll do other things first, like you guys were suggesting. So, so that is appropriate. And then it says help coordinate her care. I mean, is that ever a bad thing? So, so B, C, and D and E all seem appropriate. So yeah, I would go with A. So the answer is A. So basically, as far as the facts here, treating the whole person has always been a basic tenet of family medicine. Okay, so that's always been the case. However, now, and this is the true. Time pressures and other demands on us as physicians can easily hinder the delivery of holistic and patient-centered care. And that's what ends up happening, I think, because there is pressure there's time constraints, there's pressure to see a lot of patients, there's pressure to follow up on their care. Those pressures can sort of be a barrier to providing that holistic care. So although we know that as a family physician, holistic care is part of what you do, when a patient says that they want that, the system that you're in may prevent you from readily offering that is the problem. So that is a reality, which is like a constant tension that you encounter in practice. So, okay, good. Have you guys ever had a patient that came in requesting something like this, saying, I want a holistic approach, or I want a natural approach, or anything like that?
Yes, many times.
Yeah, can you share one experience?
I met a patient with cancer, actually, metafibromyalgia, and the patient diagnosed in second stage, but she refused the chemotherapy and insists to go to try another therapy, like this exercise and the alternative medicine, like just take a specific diet without sugar and just depend on juice for a month. She believed in this concept, but we tried our best. But at the end, she came to get the chemotherapy after her cancer advanced, unfortunately. But it's very difficult to convince this patient from the first visit.
Right. Yeah, that reminds me, I think Steve Jobs, you guys know Steve Jobs, right?
No.
Guys? Oh, guys, come on, Steve Jobs. Steve Jobs was one of the founders of Apple, the computer company, and iPhone.
Yep.
Steve Jobs.
Yeah.
So Steve Jobs was he was an entrepreneur. He was he had some, he had knowledge as far as computing and related technologies, and like the Macs that we have, right? So he helped, I don't know exactly, but I think he helped design the original Mac computer, and he and a partner, they co-founded Apple, one of the biggest companies in the world. At one point it was the biggest company in the world and still might be, I forget. So you guys know Apple, right?
Yeah, and iPhone.
Your phone, right? Your iPhone, right? So he was one of the co-founders, basically, and he died several years ago, not too long ago, actually, a few years ago.
Pancreatic.
Was that
cancer? I think he died of pancreatic cancer.
Yes, he died of pancreatic cancer. And I want to say that he had something similar where he was diagnosed with pancreatic cancer, but then he took a period where he resorted to just natural therapies and alternative therapies that he felt was I guess in line with his beliefs and preferences. So this kind of, that cancer example reminds me of that. And I want to say this next case, there's a question later about cancer as well. So anyway, you always get a little nervous when you're cancer. But actually, one of the sessions that we had earlier some weeks ago, I don't know if you guys were in it or not, but that's one of the things, is that with you know, I don't think you guys were on it because it talked about referring to specialists, I think. But when you have a cancer patient, that's one of the things that as the family physician, ideally, and if your system hopefully supports you, you help coordinate the care that a cancer patient receives. And, you know, these things come up, and that's where the family physician can be helpful in advising the patient. So, okay, I think, any questions on this part?
That's fine.
No, we can move forward.
All righty. So next up is, we're halfway through, by the way, just so you know, we're halfway through. So when traditional medicine fails, so new case, Mr. Smith is a 72-year-old man who has been in your practice for several years. He has a history of prostate cancer. There you go. There's your cancer. I knew that was in here. He has a history of prostate cancer that was successfully treated with a radical prostatectomy 2 years ago. His only other known medical problems are hyperlipidemia and moderate osteoarthritis, which tends to limit his daily activities. He has tried several nonsteroidal anti-inflammatory agents, but did not tolerate them for various reasons. He presents to your office for a routine follow-up visit, but his main objective is to ask your opinion about several CAM therapies that he is considering. Okay, I think it's a very common scenario. So this question, regarding CAM in general, which of the following is true? Patients diagnosed with cancer rarely use complementary and alternative medicine therapies because of the serious nature of this diagnosis. B, CAM treatments have not been shown to be effective in reducing pain. C, patients using prescription drugs rarely use dietary supplements. D, when taken according to the package label by relatively healthy adults, dietary supplements tend to have fewer side effects than do prescription drugs. Or E, most CAM users are older, retired individuals. What would you say? Which of the following is true?
I would say D.
D, okay. Good. I like it. It's the longest answer there. So that tends to make it an attractive option. Okay, Dr. Tahani, what would you say?
Yeah, I'm thinking of D too.
D, okay. All right, let me take a shot at it. Okay, patients diagnosed with cancer rarely use therapies. Well, we just got done talking about you guys have personal experience. Who was Dr. Abir? Was your patient with cancer?
Yes.
Wow. So clearly, Dr. Abir, your experience would automatically eliminate A, I would think, correct?
Yep.
Yep. So that's the thing. I find for these for these exams, use your personal experience, because your personal experience, by definition, was true. So yeah, and we talked about Steve Jobs and all that. So A, you can eliminate. CAM treatments have not been shown to be effective in reducing pain. Well, I think what I do know is that you know, there are, for many agents, whether it's pain or psychotropics, there is a significant placebo effect. So that placebo effect could be maybe 30% at times. So even the placebo effect can contribute to efficacy. So I think that to say it's not been shown to be effective, I have doubt about that. So A is gone. B, I think it's just, let's just look at the other ones, but I have a lot of doubt about that one. C, patients using prescription drugs rarely use dietary supplements. I think from our experience, that's just not true. So C is gone. When taken according to the package label, tends to have fewer side effects. There's a lot of credibility to that. I think that I think that I like D better than B. So I would put a pin in D at the moment. Most CAM users are older, retired individuals. I don't know about you, but that's not my experience. What about you guys? Do you guys feel like a lot of patients are younger or, that use alternative treatments?
Yeah, they're older, I think.
Older? Okay. I feel like I've seen a lot of patients who are, on the younger side. I think a lot of patients come in asking about vitamins and things like that. So when it says most of them are older, I feel like that's not consistent with my experience. So I have a lot of doubt about E. So for me, D is your most likely one. So I would agree with you guys. Let's see what the answer is. Okay, so your answer is indeed D. Good job. So as far as the facts go, although supplements can occasionally have adverse side effects, most are well tolerated when they are taken as directed on the label. Patients diagnosed with cancer or HIV infection represent some of the highest users of CAM therapy. So this experience that Dr. Abir had and the Steve Jobs example, there you go. I mean, there's plentiful examples of cancer patients who use alternative treatments. And there are even healthcare organizations that actually promote alternative treatments for cancer patients. So cancer and HIV are some of the highest users of complementary and alternative treatments. Many modalities, such as hypnosis, acupuncture, have been shown to reduce pain. I keep forgetting about chiropractic. So yes, I will refer patients to the chiropractor many, many times to address low back pain. So these modalities have been shown to reduce pain. With the exception of prayers for healing, CAM use tends to decline after the age of 60 years. Okay. So it looks like, interestingly, prayer does not decline when you hit the elderly population, but CAM, so this is good to know, complementary and alternative treatment utilization tends to decline after age 60. And that's pretty consistent with our experiences, I think. So, okay, guys have any questions about this one? If not, we can move on. So number 10, which of the following would be the least appropriate advice to offer this patient who had prostate cancer? It is best to use either conventional treatments alone or only CAM therapies because of the potential for significant adverse interactions between them. B, some studies have demonstrated benefit with the use of glucosamine products for the treatment and prevention of osteoarthritis of the knee. C, there are data to support the use of acupuncture to treat knee arthritis. D, lifestyle modifications such as maintaining ideal body weight can have a positive effect on arthritis. And E, Tai Chi and Oriental movement therapy has been shown to have a favorable impact on strength and balance in elderly patients. What is the least appropriate advice?
I would say A.
A. Dr. Tahani, what do you say?
Yeah, A too.
Yeah, me too. We just got done talking about integrative medicine, and integrative medicine is the combination of conventional treatments with complementary and alternative medicine. So to say that, no, you can only have one or the other, that's not really consistent with what we do in practice. Everything else seems reasonable to me. In fact, I remember using glucosamine a lot in residency. And I think that is something that we probably need to offer patients more so for patients with arthritis, because actually the organization where I practice, most of our adult patients do not have health insurance. So because of that, they don't have easy access to specialists. So when they have severe arthritis, it can be a challenge. And so glucosamine, I think we probably need to think of more when treating these patients. Acupuncture is something definitely to think about. In fact, the chiropractor that we refer patients to does acupuncture, and that can be, so that is can be an option for this knee arthritis. Body weight obviously can have a positive effect. Tai Chi, this seems like a reasonable recommendation. So if we look at number 10, indeed, the answer is A. All right. So most patients use complementary therapies along with conventional treatments. So most patients do. As long as each treatment is noted and evaluated within the context of benefit versus risk, like for example, the echinacea, the benefit in that patient outweighs the risk because she's not having any adverse effects and it's working for her. So you evaluate the benefits and risks for each patient. The chance of adverse reactions should be minimized. Published studies demonstrate favorable outcomes for glucosamine, acupuncture, and Tai Chi for the conditions listed. Okay, so those are all things to consider. All right. Let's see. Have you guys, I'm wondering, have you guys had any patients with like knee osteoarthritis or some other kind of osteoarthritis that was refractory to care and nothing was working?
Oh, yes.
So I'm wondering, Dr. Abir, how had you handled that in the past?
We tried many medication, but for knee specifically, I remember a patient ended up doing knee replacement.
Yeah.
So, but my experience with glucosamine, many patients respond to that and the pain improved. Yeah.
Wonderful, wonderful.
So,
Yeah, absolutely. Good. Well, thank you for that, Dr. Abir. I appreciate it.
yeah.
Number 11, regarding acupuncture in the United States, which of the following is not true? The majority of acupuncture is provided by licensed practitioners. B, it can legally be administered only by a person specifically licensed in acupuncture. C, the National Institutes of Health has stated that there is evidence to support the use of acupuncture for certain conditions, such as nausea and postoperative pain. D, pregnancy is a relative contraindication to the use of acupuncture. Or E, increased pain, bruising, fainting, and pneumothorax are possible adverse effects of acupuncture. What would you guys say?
I'm between A and E.
A and E, okay.
So,
What would you guys
say? D.
We have one vote for D, okay. Who is that? Was that Dr. Abir?
yes, me. I
Oh,
said between A and E.
those, okay. Okay, so we have one vote for D. We need one more vote. One more vote.
A.
Was that?
I'll go with A.
A, okay. All right. Now tell me, so Dr. Tahani, go ahead and walk us through why you like A.
I'm thinking not all of the Yeah, that practice acupuncture or have license provided by licensed practitioner.
Okay, now remember, it's saying which is not true. Does that change your answer at all?
Mm,
So which one of these statements is false? Does that change anything?
No, I'm seeing that they are not licensed. Not all of them are. I mean,
So you're thinking the majority of them are unlicensed.
yeah.
Got it. Okay. All right. And Dr. Abir, walk us through why you picked D.
Because I have experience with that. Many patients refer during pregnancy to acupuncture because they want to be away from medication that may harm their baby.
Right.
So I don't think it's contraindicated. But regarding the first option, they should be licensed to practice acupuncture.
Right.
Considered health, they considered healthcare professional. They should have a license to practice that.
Right. When you go get a haircut, I go around here, get a haircut. When you get a haircut, they put their license right there. Like, the people who cut your hair, they put their license right there.
Yes.
So even to cut somebody's hair, you need to be licensed by the state. So yeah, probably for that reason. So I know that. Now, do I directly know that acupuncturists need to be licensed? I'll be honest, I don't directly know. But like you would think, but also I do know that hairdressers need to be licensed. So if hairdressers need to be licensed, probably the acupuncturist needs to be licensed as well. So was that?
I read in news yesterday, one woman, I think in California, she and her daughter,
Yeah.
they practiced something cosmetic. They inject women with silicone, not content. So one of patient died because it's go to her bloodstream and cause clots, and now they arrested this woman because they don't have any license to practice this type of cosmetic surgery.
Yeah. You need to be very careful with these things. It's true. So yeah, very, very unfortunate. So so that was a cosmetic thing, and absolutely. So usually the regulations are pretty good with that. And I can tell you, D, I would agree. I mean, for sure, one of the treatments of nausea and vomiting in pregnancy is acupuncture. And there's actually a specific point. It's called Nugian point. I don't know. And I think the technical term is like the P6 point, something like that. And it is a few centimeters proximal to the flexor crease of the wrist. So yeah, that's something that is a known complementary and alternative treatment for nausea and vomiting in pregnancy. So yeah, I would go with D. So let's see what the answer is. It is B. B. Oh my God, it is B.
Really?
Oh my God, hold on. That can't be right. See, it just goes to show you never know. Come on. What? Well, wait a minute. How about that? But D though. Well, let's take a look, you guys. That just goes to show you, and don't be overconfident. Boy, I'm surprised, really. Okay, B, for some, usually I make it bold after I see the answer. In this case, I was just so confident. But all right, it was actually B. And so this was, you see, I decided not to go through each one individually. See what happens? Just goes to show you. Okay, so number 11. Okay, here are the facts. Acupuncture is an ancient healing art that in the United States uses sterile needles inserted into specific points to treat, mitigate, or prevent disease. The majority of states have, the majority of states have licensing requirements for acupuncturists that typically include completion of an accredited school and passing a national standardized test, and maintenance of continuing education hours. So that's the majority of states. However, other practitioners who have their own licensing boards, such as physicians and chiropractors, may also perform acupuncture in many states. Okay. I don't get it. This is a, you know what I'm wondering? I'm wondering if this is, gosh, let me make sure this is the right question. Hold on a second. Because did you guys understand all that?
A little bit confusing because it looks like A.
Which of the following is not true? So pregnancy is a relative contraindication then? Huh. And A is not true, the majority are not? Wow, yeah, that one I'm just not getting. Do you guys get it?
No.
Yeah, I am not getting it. So the majority of states, okay, the majority of states have licensing requirements. Okay. Oh, okay, so for B, what it's saying is that physicians, so if you are licensed as a physician or as a chiropractor, you can do acupuncture. You do not have to be specifically licensed in acupuncture.
Yeah, this is why I choose A, because I hear some people who are not licensed in acupuncture and practice it.
Yeah, yeah. Yeah.
So what is the difference between A and B?
Yeah, but if it's some people who are, so you're saying that you heard some people do acupuncture, but they're not licensed in it, right?
Yes, this is why I choose A.
Yeah, but that makes A true, I think. The majority of acupuncture is provided by licensed practitioners. So that means that there are some people who are not licensed. So you know what I mean? If some people are not licensed, that A can still be true, because A is saying just the majority, not all, but the majority.
Yeah, okay.
B, so B I understand. It says here, it can legally only be administered by a person specifically licensed in acupuncture. In some states, if you are licensed as a physician but are trained to do it, or if you're licensed as a chiropractor and are trained to do acupuncture, then you can do acupuncture. So B, I understand. C, so I can see why B, as it's written here, is not true, okay? Because you could be licensed as a physician and chiropractor and not specifically licensed in acupuncture. Okay, so we get that. C, okay, I think, there's evidence to support that it can be helpful for nausea and postoperative pain. D, I'm surprised on though. Pregnancy is a relative contraindication. See, because there's a specific thing about nausea and vomiting in pregnancy. That's crazy. You know what? Let's double check it. Let's go back to, in this case, let's try up to date again. So let's see. Like, that is ridiculous. Hold on. Acupuncture. Let's look up pregnancy. Look at this. Okay. So pregnancy is not an absolute contraindication to acupuncture. since acupuncture has been used and studied for gestational conditions such as breech presentation. Okay, that's another one. Forgotten about that. Breech presentation and pregnancy-associated nausea. According to acupuncture theory, however, some points can induce labor, and the acupuncturist should be informed of the pregnancy. So it says here that there are other conditions that are not contraindications but warrant special consideration. Yeah, I guess it's just on how they word it.
Yeah,
Yeah,
because the relative.
Yeah, it said relative contraindication, but to me, this is not even a relative contraindication. You know what I mean?
Yes, for me too.
It's not even relative. It just says special consideration. It's almost like you're doing a colposcopy on a pregnant patient. You can do a colposcopy on a pregnant patient, but there's a special consideration, like you don't do an endocervical curettage. To me, it's something like that. But it's not like a contraindication, you know? So yeah, it's more of a special consideration to me. What do you guys think? Have you guys, well, let's ask this. Have you guys had any pregnant patients do acupuncture? Have you had that in the past?
Not for me.
Yes.
I'll be honest, I can't recall one either. You know, I've delivered over 1,000 babies. I cannot recall a pregnant patient doing acupuncture, actually. It's not to say it didn't happen. I just can't recall off the top of my head. So yeah, I think this is a bad question. If I were to do this over, I would say D. It's not a relative contraindication, actually. So anyway, but I think we understand the point of B. So, okay, let's move on if there are no questions. Regarding manual therapies, which of the following is not true? Back and neck pain, along with headaches, are common reasons people seek manual therapy, such as osteopathic manipulation treatment. Chiropractic care has been demonstrated to provide a higher degree of patient satisfaction than typical conventional care for the treatment of acute low back pain. C, the majority of acute low back pain episodes resolve within 6 months regardless of the therapy used. D, the risk of a serious adverse effect such as stroke or spinal cord damage from manipulation is approximately 1 case per 1,000 manipulations. Or E, osteoporosis, pathologic fractures, and significant rheumatoid arthritis are contraindications to thrusting type therapies. What would you guys say?
I would say B.
What's that?
B, the second.
Okay, got one for B. All right. Dr. Tahani, what do you say?
I say C.
C, okay. All right, let me give it a shot. Hang on. Okay, so back and neck pain along with headaches are common reasons people seek manual therapy. I believe so. I mean, such as osteopathic manipulation treatment. I mean, that seems consistent with what I've seen. B, chiropractic care has been demonstrated to provide a higher level degree of patient satisfaction than conventional treatment. So I don't, you know what? So my experience is that actually is true with the patients that I have seen in the past few years. There's a chiropractic clinic who has amazing patient satisfaction. Like the customer service of his staff is phenomenal. And so to me, actually, there's evidence for that for me in terms of experience. So, so A and B, I don't have really a favorite one in those. I'm going to keep going. The majority of acute low back episodes resolve within 6 months, regardless of the therapy used. I believe that's true. I think the majority of low back pain will resolve. So I think C, I believe that's correct. So far A, B, and C, I don't have a ton of doubt about them. D, the risk of a serious adverse effect such as stroke or spinal cord, 1 in 1,000. Ugh. See, I have no idea. I do not know. So I don't know. If I compare the level of doubt I have for D with the other ones, the majority resolves within 6 months. I feel like there's truth to that. Demonstrated higher level of patient satisfaction than conventional care. So, I don't know, maybe I should re-examine this. And then A, I think A, I don't have a ton of doubt about. So B, if I have any doubt, I would place B over A and C. Now, if I compare B and D, the risk of a serious adverse effect such as stroke or spinal cord damage from manipulation is about 1 per 1,000. I just don't know. To be honest, 1 out of 1,000 seems like a lot, to be honest. I mean, if a chiropractor has like 2,000 manipulations a year, so you get 2? I mean, that's a lot. I don't know about that. Osteoporosis, pathologic fractures, and significant rheumatoid arthritis are contraindications to thrusting type therapies. That sounds reasonable to me. You can certainly cause damage depending on the manipulation. And I don't know, I'm not really familiar with the specific therapies, but thrusting type sounds pretty aggressive. So it would make sense not to use it in these conditions. So I don't have a ton of doubt here. So I have the most doubt about B and D. So the question is, which one do I have more doubt about? Higher degree of patient satisfaction than conventional care, risk of serious adverse effects from manipulation. I just don't know. I just don't know. So what do I know about adverse effects? Well, it can happen. I just feel like it can happen. These are pretty serious. Stroke, spinal cord, something serious. I mean, that's pretty serious. And I know that, for a busy practitioner, you can get 1,000 visits in a year pretty easily. I mean, that we're only talking about 20 visits a week. So, and I just feel like if that's the case, one serious event a year just seems like a lot. So based on that, I don't know. I would go with D based on that. So, okay. You guys ready to see the answer?
Yes.
I think B, I actually don't know, but I feel like I have my experience here is that they tend to have good patient satisfaction with this one chiropractor in town. Okay, I'll go with D. Let's take a look. Answer is, woo, D.
Good job.
Thanks. So part of the rotation is test taking skills, by the way. All right. So that was my rationale because I basically was thinking out loud. So, all right, so 12 is D. Okay, let's take a look here. So the risk of serious complication from manipulative therapy is estimated to be between 1 in several 100,000. That makes more sense. To have one event like this once a year seems unacceptable. So 1 in every 100,000, maybe you get one case every 100 years, makes more sense to me. Okay, so it's actually, I'm not done. I should finish reading. It's estimated to be between 1 in several 100,000 and 1 in a million. Okay. All right. So there we go. So it's not 1 out of 1,000. It's 1 out of every several 100,000 to 1 out of a million. So good. Although most acute low back pain does not resolve. Oh, interesting. Yeah, you see? Interesting. Oh, weird. Hold on. Hold on. Although most acute low back pain, does resolve. I'm sorry, it does resolve. So most acute low back pain does resolve within 6 months, regardless of the therapy used. Chiropractic has been associated with higher patient satisfaction levels, according to a study published in the New England Journal of Medicine in 1995. Okay, so there's actually evidence for higher patient satisfaction with chiropractic care for this condition. Okay, so good. Now I'm wondering, what experience do you guys have with the chiropractic office? Have you had much experience working with them?
For me, no.
No? Okay. What about Dr. Tahani?
No, also.
Yeah. We definitely make use of a chiropractic office here in town for sure. There are a lot of patients with low back pain and also patients who don't have insurance. So it's interesting because we try and refer them to physical therapy and we can't because they don't have insurance. So basically, because of that, we and this is very common for us when a lot of our patients don't have health insurance, they're underserved, they're poor. Complementary and alternative medicine really helps a lot. So yeah, we use them frequently. And it's interesting because I can actually bring up the chiropractor that we use. So if we say, I don't think, like, this is going on YouTube, I don't think you would care, to be honest. Let me see. So new share, let's go here. And then it's the Mailer Chiropractic Clinic. So the reason I bring it up is we can actually look at the patient satisfaction. If you look at his patient satisfaction, here's the clinic. And we can see that out of 170 Google reviews, he has 5 stars. Now, I'm sure he encourages a lot of folks to go on there to go and put it on there, but that's a good idea. But even just interacting with his staff, patient feedback, they tend to have good satisfaction from going there. He actually makes an accommodation for our patients who don't have insurance, so they don't have to pay a large fee. But if you see 170 Google reviews averaging 5 stars, so you can see the degree of good patient satisfaction. So that is consistent. That's the experience that is sort of consistent with what B is saying. So, all right, guys, if there are no questions, we'll move on to the next one. So number 13, because your patient in this case has been treated for prostate cancer, he is naturally concerned about other forms of malignant disease. He is wondering if he should start a special detoxification diet that has been recommended by his granddaughter. Which of the following is the most appropriate response to this? A, inform him that his body naturally detoxifies itself daily, and this regimen is a waste of time and money. B, tell the patient that you are unfamiliar with the treatment, so there is not much you can do to help him. C, inform him that diet has no impact on one's cancer risk. D, offer to review the information that he has brought to the visit and set up a follow-up appointment to discuss this. Or E, set up a referral for him to see a gastroenterologist to discuss detoxification diets. What would you guys say for this one?
What about D?
Okay, we have one vote for D. Good. What? Okay, next vote.
Between A and D, but I'll go with D too.
You like D? I like D too. I'll vote for D. So, so inform him, if we go through them, inform him that his body naturally detoxifies itself daily, and this regimen is a waste of time and money. There are just multiple things wrong with this answer. So the body naturally detoxifies itself. Like, for what? I mean, I don't know what it's talking about, and I don't know what evidence there is to support what it might be talking about. So I need more information on this. And this regimen is a waste of time and money. Well, I mean, is it? And, you know, rarely would you ever tell a patient that it is a waste of time and money, that something is a waste of time and money. That doesn't happen too often, I feel. Yeah. And, you know, you don't even know the details of this diet, so to say it's a waste of time and money is strange. And really, let's just say, even if you knew what the diet was and you felt it was ineffective, but he felt better, even then, I mean, that's enough to not say it's a waste of time and money, actually. So A, I don't like very much. B, tell the patient that you are unfamiliar with the treatment, so there's not much you can do to help him. That is not ideal, you know? So to say, well, I don't know what this is, I can't help you. I mean, for goodness sakes, okay, I mean, maybe you want to refer if you can't, but there's a better answer to this, which you guys already selected. So to say, just because since when are you unfamiliar with something? And then you say, well, I can't help you because I'm unfamiliar with this. That doesn't happen very often. So you don't like A or B. Inform him that the diet has no impact on one's risk of cancer. So we're talking very general terms here. We're talking risk of we're talking general cancer. We're talking about some general diet. So diet, we know, does have an impact on cancer. So so to say that that diet, just saying flat out, not even saying his diet, but just to say diet has no impact on one's risk of cancer, I mean, we know that to be false. I mean, that you just eliminate. D, offer to review the information that he has brought up the visit and then set up a follow-up appointment to discuss. So I was actually advised to do this in residency for some things. So let's say a patient comes to you with an issue and you just need to review it real quick. You know, you need to review it, maybe even talk to a colleague if you want. You just need a review in order to get back to the patient. That is very reasonable. It is a very reasonable thing to do that. So in this case, the patient comes with some specialized diet. You can research it. You have resources to research it. You have time to talk to a colleague. And when the patient comes back, you can then discuss it with the patient. And it doesn't have to be about this. Sometimes it can be a specific clinical question. So any specific clinical question, if you feel like, you know what, I just need to review this real quick and then talk to the patient about it during a follow-up appointment, totally reasonable thing to do. And then E, set up a referral to a GI to discuss detoxification diets. This is completely inappropriate, and your gastroenterologist will hate you. You know, I think that this is not the best use of a gastroenterologist's time. You want to refer to the gastroenterologist to do things that you cannot do. You will better serve the patient and your colleagues by reviewing it and discussing it with the patient at a later time. That is a much better utilization of resources than taking up a specialist time to talk about an alternative, you know, treatment. And if you think about it, it doesn't make sense. I'm going to refer to the specialist to talk about a complementary or alternative treatment. I don't know about that. So you usually don't refer to a specialist in order to talk about detoxification diet. Actually, you might, you know, if you do refer, it could be to an alternative medicine specialist or a complementary alternative medicine specialist. That would be something that you could potentially refer to. but not GI. Anyway, I agree with D. Let's take a look. Answer is D. So summarily dismissing his concerns and questions, okay, and that's the other thing about A, is that you're very dismissive of what he's bringing to you, and I didn't even highlight that, and that's true. So summarily dismissing his concerns and questions, especially those validated by friends and relatives, can easily undermine your relationship with the patient. Because look, his daughter, who he may trust way more than you, recommended this. So to say, oh no, that's a waste of time and money, well, this came from his granddaughter. So it's true, you actually undermine your relationship with the patient when you do that. If you are unfamiliar with the therapy in question, offer to spend some time researching this for the patient. Patients are usually much more receptive to hearing that a particular treatment has no documented benefit once they know you have actually evaluated it in an objective manner, okay? So the patient will be more receptive to your information after you have researched it. And by the way, in the past, I have done this. A few times at least, where I talk to the patient, say, I'm going to review this. Let's talk about during a follow-up visit. So this is something that I've done, and patients usually receive it quite well. It usually is not a major problem. And in fact, patients, I think, are grateful that you are investing time to, answer a question for them. So I usually have had no difficulties when doing that with a patient. So I'm wondering, have you guys ever done this kind of thing in the office where you tell a patient, you know what, let me check this out, and let's have you follow up, and let's talk about it after I have a chance to review?
Yes, I have a specific case. It's typically like this one. And the patient asked about detoxification treatment for her kids who had autism.
Oh, very good, Dr. Abir. How did that go? What happened there?
It is many years back, but maybe 2 years. I just reviewed that and I didn't find any something to support that. So I explained that to the patient, but I don't know if if I give her this advice and follow me, or I don't know what's happened after that. I don't have any connection with them after that. But I remember this case about, she said, and it's very, very expensive. She said a big number, thousands of dollars about this detoxification treatment. I explained to her this is something inside the body, and there is no any research or evidence based in the literature support this kinds of treatment.
I see. So wow, you had this exact situation. When you were discussing your opinion with the patient, how did she receive it in the office?
The patient usually they feel despair because there is no treatment for autism at this point. So as a parent, they want to try everything they could. But it's very difficult to convince them, don't try this. And and there is a lot of misinformation online.
So it sounds like the patient or the mom was disappointed in the office. And what happened after that? Did she ever come back, or, did you ever did you care for her kids after that?
No.
I see.
Yeah.
So and how did you know she was disappointed? What did she say, or what did she do?
Because she said she tried many treatment, many sessions, and the doctor advised her to manipulate the diet, but there is no response. So this is an option for them. They want to try it.
Right. Very interesting.
And she is not a regular patient, just one visit to discuss this issue. She wants my opinion in that, if I can agree with her or not.
I see.
But I remember there is no evidence to support this treatment in treating autism specifically.
I see. Very good. Very good. Yeah, and it's interesting because when when I was first reading this, the body naturally detoxifies itself. It's not that this isn't untrue. And that's what it sounds like you were conveying that to the patient, that the body does have some natural mechanisms. So it's not that this isn't untrue. It's really more the second part of the answer where, you don't want to be dismissive of the patient. So it sounds like in your answer to the patient, you kind of highlighted the first part of part A, it sounds like.
Yeah.
Yeah. Okay. And how did you feel after that? Did you feel like that went as appropriately as it could have? Or do you feel like did you feel like maybe there was an opportunity to word something or do something differently when talking to the mom?
Yeah, I advise her to continue the proven treatment like behavioral therapy and occupational therapy and speech therapist to follow with this providers, because there's evidence they can improve. But about the other, I didn't find any information to support this kinds of treatment in treating autism.
Got it. Okay, very good. Well, yeah, thank you for sharing that encounter. That was very helpful. Okay, guys, we have 3 more questions, okay? just so you know. So number 14, which of the following statements is not true? Patients wanting holistic cancer therapy typically must go to Mexico because these services are not available at reputable centers in the United States. B, mind-body therapies such as hypnosis have been shown to reduce the need for narcotics in some cancer patients. C, support groups are often helpful when a patient is facing a serious medical problem such as cancer. D, acupuncture can be used as a complementary therapy to help palliate the nausea associated with chemotherapy. Or E, guided imagery has been shown to have a positive effect in some cancer patients. What would you say?
A. Yeah, I would say A too.
A, okay. Yeah, I would say A also. So if we go through it, when I look at A, I mean, again, there's a colleague in town who, as an alternative medicine, a complementary treatment specialist. So to say that this service is not available at reputable centers in the United States, and also there are healthcare organizations that promote holistic cancer therapy, actually, now that I think about it. I mean, you see commercials where they make a big deal about their outcomes and how. Actually, I think I'm recalling some specific commercials where they're saying we do the medical stuff, but we also take care of the whole person and we focus on your nutrition and things like that. So yeah, A is just not true. So that's your answer. But if I look at the other things, mind-body therapy such as hypnosis have been shown to reduce the need for narcotics in some cancer patients. I believe that there is, that seems like a very realistic, even though I don't know the specific data, that seems like a very realistic possibility. C, support groups are often helpful when a patient is facing a serious medical problem such as cancer. There's not reason to doubt that. D, nausea, acupuncture for nausea associated with chemotherapy. I don't have a lot of reason to doubt that. Likewise, E, same thing. So B, C, D, and E are kind of all in the same boat. So let's make sure. And yes, indeed, the answer is A. So many medical centers that treat patients with cancer now offer complementary therapies. Okay, so it's not just these specialized organizations, but it's moving in. I mean, it's considered, it's, and I'm not an oncologist, but it seems that that's something that many centers are paying attention to. So many centers now offer complementary therapies. These offerings include mind-body techniques, acupuncture, and nutritional support, along with the conventional therapies for patients who are interested in those options. So, okay. Regarding hyperlipidemia, match the following treatments with the best corresponding statement. Let's just do this together. Fish oil, what do you guys think? I think it's C. I think it's helpful for triglycerides.
Yeah, I agree.
Okay, garlic, what do you think?
E?
E?
Or C?
Yeah, I really don't know. You know, if I look at here, statin-like properties, is it rice, walnuts? This sounds like some kind of oil. What do you guys think for garlic?
I said E, but I'm not sure.
Yeah, you know, sugar, when I look over here, I mean, walnuts don't come from sugarcane. Rice, I don't think comes from sugarcane. Neither does garlic. I want to say this is B, actually. So we got B and C out of the way. Common herbal with some evidence of mild lipid lowering. Well, walnut is not an herbal. Red yeast rice. Is that, I mean, that's not an herbal. Garlic. Can garlic be considered an herbal? What do you think? Let's see.
Yes.
You think so? I mean, is that
Yeah.
just seems like an oil to me. I don't know. Or it's just some sort of organic compound. I don't know if it's an herbal. Okay, we have rice and walnuts. So we didn't do anything for A. So A contains statin-like properties.
Could be walnut.
You think so? I have no idea. So walnuts. Why do you say walnut?
I'm not sure, but I have heard it may reduce the bad cholesterol.
Is that right? Oh, bad cholesterol. Well, that's what a statin does.
Sure.
Okay. Well, we could do that. And then E, this is the last one. So red yeast rice, daily small amount may have beneficial effect. Yeah, I don't know. Yeah.
I haven't heard about red yeast rice.
What's that?
I haven't heard about red yeast rice before.
The triglycerides?
No, I haven't heard about red yeast rice before.
Oh, really? Yeah,
What it is.
I can't say that I recall. Or maybe garlic. Maybe, do you think E could be D? But if garlic is E, then what's D? Herbal. I mean, that's not an herbal. That's not an herbal. That's not an herbal. I mean, and does the other stuff come from sugar cane? None of the other stuff comes from sugar cane. So are you guys good with this?
I was thinking E is garlic.
You think E is garlic? Yeah, I feel like it could be garlic too. Yeah, so D, but which one is an herbal? It says common herbal. So if E is garlic, then D, red yeast rice, is red yeast rice considered an herbal?
Actually, I don't know what is reduced rice. First time to hear about it.
Yeah, I don't know much about it. Well, are you guys, so Dr. Tahani, like, what would you recommend? Is there anything here you would recommend changing?
I think garlic E, because
Garlic is E, okay.
they said beneficial effect, because I have heard it's may reduce high blood pressure and cholesterol. So it could be E.
Right. So, okay. Now I was talking about hyperlipidemia though. It says regarding hyperlipidemia, does that change your thinking at all? That's a hard one, huh?
Yeah, let's check the answer.
Okay. Well, let's do our best with let's do our best picking it. So, are you guys good with this? We're calling red yeast rice an herbal, and we're saying E is garlic. So, are you guys good with that, or do you want to make any last second changes?
I'm good with that.
You're good with this?
Yeah, yes.
All right, let's see. 15. Okay, fish oil is C. Garlic, it was D. Red yeast rice, red yeast rice was A. Oh, we got a bunch wrong, man. Yeah, should have thought about that. Red yeast rice was A. Walnuts is, okay, walnuts is E. And then polycosanol is B. Well, so
Difficult question.
yeah, the red yeast rice thing really messed us up, actually. So yeah, that's really it. There's no other explanations or anything. So fish oil is triglycerides that we got. Garlic, it's a common herbal with some mild lipid lowering. So got that, okay. Red yeast rice contains statin-like properties, okay. Walnuts, small daily amount may have beneficial effect. And polycosanol comes from sugarcane. That's it, okay. All right, now at least we became familiar with some with some of the alternative treatments for lipids. And to be honest, I think where this comes into play is sometimes patients, they don't want to be on a statin. And so when patients don't want to be on a statin when they should be on a statin, that's where this stuff comes up. Fish oil definitely is helpful for triglycerides, no doubt about it. But then there's some other things. So there's some multivitamins too, like Centrum Cardio. I know in the past that was something I would do if a patient didn't want to be on a statin. But these other things then can be helpful. Sometimes patients will say, look, I don't want to be on a statin right now. Let me do some lifestyle changes to help with my cholesterol. And if after a while my cholesterol is still not good with diet and exercise, then I'll do a statin. So in those types of patients who don't want to be on a statin right now, these other things can be helpful. Okay. And even the so when we talk about statin-like properties, that's where the red yeast rice comes in. If they have a high LDL, Yeah. So, and I'm curious actually, if we do, and so I'm wondering, what do you guys do when you have a patient who doesn't want to be on a statin? Are there alternative things you will recommend? Have you encountered that in the past?
As you said, the lifestyle modification, like change the diet, supplement, nuts, fish oil.
Right,
Then
right. I'm wondering if polycosanol, if you can actually do a prescription for that. Let me see. This is goodrx.com. Have you guys ever used this? Have you guys ever used goodrx.com? This is a website that you can provide coupons for patients who don't have health insurance. And this makes medications much cheaper. So it's called GoodRx. So if you pick any medication. So here's atorvastatin. We're talking about lipids. You can generate a coupon and you can see how it makes the prices much cheaper. So you can literally go to this website, put in, type in your medication, get these coupons, and then you can actually print out, you can print out the coupon based on the pharmacy that they're going to. So it's called goodrx.com. It's very good. It's very good. So I'm going to actually see if I can get polycosanol. Here we go. So the polycosanol, lipid management with diet or dietary supplements. So there's an article about it in Up to Date. So polycosanol is a drug extracted from sugarcane wax that contains a number of aliphatic alcohols. While previous studies, I guess, suggested a reduction in serum lipids with polycosanol, in a randomized trial, there was no improvement in any measurement of serum lipids. So for what it's worth. Okay. All right, guys. Last question. Which of the following statements pertaining to cardiovascular health is true? Chelation therapy has been demonstrated in large randomized controlled trials to have a positive weak effect on coronary artery disease. B, fish oil has been shown to reduce the risk of fatal arrhythmias in post-infarction patients. C, the American Heart Association diet has been shown to be more effective at preventing coronary events than the Mediterranean diet. D, although herbals may have significant drug-herb interactions, no negative effects have been shown between herbals and aspirin therapy. Or E, diets with less than 10% of the total calories from fat are the most effective at preventing further coronary events and are the easiest to adhere. What would you guys say? Which one is most true? What would you guys say?
what about C?
Yeah, okay, got one for C. Okay, Dr. Tahani, what would you say?
Yeah, I'm going to see too.
C, okay. Yeah, I kind of like C also. So when I look at A, I have a lot of like large randomized controlled trial positive effect on coronary artery disease. I'm sorry, I've never heard of it. I would think that if it was demonstrated in a large RCT, we would have heard about it. So I just have never heard about it. So I think I have a lot of doubt about A. Fish oil has been shown to reduce the risk of fatal arrhythmias in post-infarction patients. Yeah, I have never come across this, to be very honest with you. So I have some doubt about it. I mean, I could be wrong. It could be something I'm ignorant of, but I don't recall fish oil reducing the risk of fatal arrhythmias after an MI. So, I mean, I think fish oil, what I do know about it is that like in large cohort studies where, you know, you've had some NIH sponsored studies like that was related to the Women's Health Initiative and other related studies where fish oil was found in a population of nurses to decrease the incidence of cardiovascular events. That I know, or that I have come across, I should say, but this one, B, I have not. So I just have some doubt about that. C, the American Heart Association diet has been shown to be more effective than the Mediterranean. Yeah, I mean, I don't have a ton of reason to doubt that. I don't know it for a fact to be true, but I think I have, I mean, I think B is better than A. I think C is probably better than B. D, although herbals have significant, oh yeah, so no negative effects between herbals and aspirin. Yeah, I just have doubt about that. Again, I don't know for sure, but dude, I think, you know, we got done talking about ginkgo biloba before and stuff. So I have doubt about D. So far where I'm at is I like C better than B, and I like B better than A and D. E, diets less than 10%, where less than 10% of total calories are coming from fat, are most effective, and it's easiest to adhere. So for me, that's the part where I have some doubt about. It's easiest to adhere. And the thing is, okay, I mean, since when are diets easy to adhere to? And it's easiest to adhere compared to what? Compared to what other ones? So I think I probably like C better than E. So yeah, I think I would go with C. Pretty sure. Yeah. Yeah. Even C, I'm not 100%. Yeah. Gosh, I don't want to get it wrong. This easiest to adhere to thing bothers me. So yeah, I think based on that logic, I would go with C. And oh, you guys, the answer is B. It is B. Ah, darn it. Darn it. Darn it. Oh, I'm so mad. I'm so mad. I'm so mad. I'm so mad. Yeah. I should have thought about it a little bit more. Okay. Let's go through it. Omega-3 fatty acids found in the oil of many cold water fish have been shown to have several positive effects on cardiovascular health, including a reduction in triglycerides, okay, know that, fatal arrhythmias, all right, and ischemic strokes. You know, the thing about fish oil is that it's thought to have like a mild anticoagulant effect also. Yeah. I'm so mad, you guys. I thought I had a real shot at this. I was just biased between B and C. Yeah. All right, well, let's just keep going. So anyway, so the triglycerides can be, or the fatty or fish oil, or the omega-3 fatty acids, again, can be helpful in reduction in triglycerides, fatal arrhythmias, and ischemic strokes. Chelation therapy, the use of EDTA to remove cholesterol plaque, has not been demonstrated in any large randomized study to have a positive effect on coronary disease. The Mediterranean diet consists of lean meats, nuts, fresh fruits, and vegetables, moderate amounts of fat from oils and fish, and some wine. This diet has been shown in some studies to have a more favorable effect on cardiovascular disease Then the American Heart Association diet. Diets with moderate fat levels, such as this, are typically easier to commit to than the ultra low fat diets, such as the Ornish diet. So again, talking about how, adherence here can be difficult. So I think I'm trying to see where my thinking process was wrong. I said I like C better than B. You guys like C too. So why don't you guys share with me? Why did you guys like C better than B in this case? We're all in the same boat here. We all like C better, so.
Yeah, fish oil, I haven't heard it is from one of the regimen after post-MI.
Yeah. So Dr. Tahani, why and what, Dr. Tahani, as far as your thinking for C, well, why did you like that better than B? Dr. Tahani? Did Dr. Tahani leave?
Sorry,
No,
I have some connection problem. I couldn't hear.
Oh, sure. Dr. Tahani, why did you like C better than B in this case?
Actually, I'm not sure. I thought the American Heart Association diet is more effective.
Yeah.
I think I read something like this before.
Yeah, I kind of fell into the same trap. When I think about my thinking was, I said, B, I don't know. C, I said, I don't have reason to doubt it. So I think my thinking process was not correct here. So I was saying, I don't have reason to doubt it. But I think what I should have asked is, what do I know about this? So I know from clinical experience, the American Heart Association is not something that we recommend over the Mediterranean diet. In fact, just the opposite. In practice, the Mediterranean diet, we actually recommend more often than the American Heart Association, to be honest. So that was a piece of experience that I failed to tap into. And so, I think that based on that, really, and the question is, the American Heart Association diet, that's older. And the push for the Mediterranean diet was more recent. So it leads me to suspect that maybe there's not a ton of evidence, there's at least some doubt about how much evidence there is for the American Heart Association diet. So I don't know this. And for fish oil, the fish oil, I don't know, I just don't know, but we did know some benefits of fish oil. There were some clinical benefits. C, there was actually some personal clinical experience that is kind of contradictory to C, because we actually, if I look at the number of times I recommend the Mediterranean diet and the number of times I've recommended the American Heart Association diet, I have recommended the Mediterranean diet way more than American Heart Association. So that experience is actually contrary to C. So if I thought about it more objectively, then probably there's more doubt about C than B if I thought about it objectively. So that's probably how I could have thought about it differently. And to be honest, I think I got a little bit biased when I said, oh, the American Heart Association. Oh, okay. So I think I got a little bit biased by that as well. So that's how I would think about it differently. So, and now we know that fish oil does improve triglycerides. It does decrease fatal arrhythmias after an MI. It does decrease the incidence of a ischemic stroke. And we do know that it does have some mild anticoagulant properties. So, so now we know those things. So when it comes to fish oil, what experience do you have? Do you guys have prescribing fish oil in the office? Any? This is the last question, so you guys are almost done. Guys have any experience prescribing fish oil in the office? Hello, did you guys leave me?
No, I answered. I said for high blood pressure and heart disease in the family, some patients said, I just want to take as a prophylaxis, something like that, and high cholesterol too.
Okay, wonderful. What about you, Dr. Tahani? You're muted, by the way, just so you know. Any, have you prescribed fish oil in the office?
Yeah, I prescribe it for high cholesterol and hypertension.
I see, okay. I think personally, I prescribe fish oil in the office when, you know, when I look at my lipid panel, so this is personally how I go about it. When I look at the lipid panel and if it's, you know, if it is a patient that does not need to be on a statin and the triglycerides are beyond 250, because in my mind, 150 to 250 triglycerides is borderline. So if it's beyond 250, I'll prescribe fish oil for that patient if they don't need to be on a statin. If they need to be on a statin, then, you know, I go with the statin. But if they don't need to be on a statin and triglycerides are above 250, I'll go ahead and prescribe a statin a lot of times. So, or I would go ahead and prescribe fish oil for them, especially if they have risk factors, like if they have hypertension or other risk factors for cardiovascular or cerebrovascular disease, you know, then especially in that setting, usually I'll prescribe it. And when I prescribe fish oil, I usually prescribe either 1,000 or 1,200 milligrams once a day. So that's what I'll usually do. So, okay. Well, I think that pretty much does it for this week. So looks like we spent well over 2 hours on this session. Do you guys have any questions before we sign off?
No.
I have a question as general related to family medicine practice. If the physician see a patient in the office and the patient needs admission to the hospital, so as a primary doctor, you have to do the admission or just send the patient? You have to admit the patient and follow up with him.
So that would depend if you have admitting privileges to the hospital. So if you have admitting privileges and you're a member of the medical staff of that hospital, then yes, you can admit the patient. You can admit the patient and take care of the patient in the hospital. The other part of that is that that's assuming that as the family physician, that is part of your practice. So part of being a full spectrum family physician is you do inpatient care as well as outpatient care. So there are some family physician or many family physicians nowadays, they don't necessarily do full scope. Some will do just, or a lot will do just outpatients and not do any inpatients. So if that's the case and they don't have admitting privileges, then what happens is then they would need to send the patient to the hospital for someone else to admit them and take care of them. Some family physicians actually do only inpatients and they don't do any outpatients, and that's called being a hospitalist. So some family physicians do that. It could be because the schedule is a little bit more conducive to a work-life balance. You know, you work 1 week on, 1 week off, or something like that, or you just you know, you have certain shifts that you do. So it's easier to manage time, perhaps. So a lot of new graduates, a lot of new family medicine graduates are doing that. Ideally, it's good as the family physician if you are able to take care of the patient throughout the whole spectrum. So both inpatient and outpatient, that's ideal. The reality is many family medicine specialists, graduates, and so forth are not doing the total full spectrum of both inpatient and outpatient. But ideally, yes, that would be ideal for the patient because, and I think we talked about it during either last session or the session before, when the patient gets admitted, you have a relationship with the patient. So when talking about the ethical decision-making issues that oftentimes come up in the hospital, you are ideally positioned to address or to help work through those ethical decision-making processes. So did that answer your question?
Yes, thank you very much.
Do you guys have any other questions about family medicine in general? Okay, sounds good.
Thank you.
No,
What's that?
I said no.
Okay, all right, sounds good. All right, guys, well, thank you very much. And so I'm wondering, will you guys still be doing your rotation next week? Guys,
it depends. What did you say?
What's that?
I said it depends. Officially, I think now it is 5 weeks. But if you want us to attend,
So
we can do that.
Sure. My suggestion is, so I will defer. I'll have you defer to the administrators for the rotation. So I'll be doing this every week. And so as far as how long your rotation lasts, I would recommend you work with the administrators on that. But I'll be here every week. You're welcome to come. So as far as how long your rotation lasts, please work with the administrators that helped you get this rotation. Please work with them on their official dates, but you're welcome to come for as long as you want.
Okay, thank you so much.
Okay, thank you very much.
All
I
right.
appreciate that.
Well, thank you guys very much, and we will do this again next week. You guys have a great day.
You too. Thank you.
Thank you.
You too. Thank you. Bye. Have a nice.
You too.